Fetal bradycardia after an epidural. Here are 3 things to know. Number 1, labor epidural placement is associated with fetal heart rate changes, including bradycardia or decelerations. Most of the time, this does not happen, but it's definitely not uncommon. In studies, the incidence ranges from 4% to 30-ish%, depending on the epidural initiation technique, of which there are several. A straight epidural versus a combined spinal epidural versus a dural puncture epidural, dosing variations among those groups, and on the time frame being studied since the epidural was placed, for example, the first 15 minutes or 90 minutes. Number 2, regardless of how it's defined, no studies have shown any effect on the outcomes of the babies, looking at things like APGAR scores, cord gases, neonatal acidemia, or an increased risk for C-section. So we basically know not to panic if we see fetal heart rate changes after an epidural. Number 3, what actually causes this is not well understood, but all the mechanisms that are most likely are all indirect. So due to a change in mom's physiology as opposed to a direct effect of medication on the baby. Epidurals can lower blood pressure, and low blood pressure can decrease uteroplacental perfusion, which can then lead to fetal heart rate changes. But low blood pressure is not the primary or only mechanism. Often we see fetal heart rate changes in the absence of low blood pressure, and we can see low blood pressure without any changes in the heart rate. Of course, if there is a fetal bradycardia, it makes sense to check the blood pressure. It's very easy to measure, and we can very quickly start initiating treatments. The more likely mechanism is related to rapid pain relief, which causes a decrease in circulating catecholamines, especially epinephrine. Beta-2 agonists work on smooth muscle, causing relaxation of the uterus. When that beta agonism goes away, the uterine tone can increase, contractions can pick up, the uterus can become hyperstimulated. Increased uterine tone can then lead to reduced uterine blood flow. This is more pronounced the faster the pain relief is. So there's probably an increased risk for this type of thing for patients who are in a lot of pain prior to their epidural placement. Other contributing factors could be positioning of the patients after the epidural. If a patient is placed completely flat on their back, there can be some aortocaval compression, leading again to reduced blood flow to the uterus. For combined spinal epidurals, if opioids are used in the spinal dose, this seems to increase the chances of these changes, possibly due to a direct effect on the uterine tone as well. Finally, one last hypothesis is that the epidural can relax the pelvic floor muscles, leading to faster descent of the fetal head, which can cause cord compression and classically be seen as variable decelerations of the fetal heart rate.